Hi friends, in view of September being declared as the PCOS Awareness Month by the Polycystic Ovarian Syndrome National Association, we are going to bring you a series of videos on different aspects of PCOS. This is Dr. Rajeshwari, Senior Gynecologist at Care Hospital, High Tech City, Hyderabad. So in the first video, we are going to talk about the diagnosis and the four main components of PCOS. The four main components are irregular menses, obesity, hirsutism, and anxiety disorders. Firstly, irregular menses. Irregular menses is very characteristic of PCOS. People complain of lesser menstrual cycles, that is less than 9 cycles in a year, very less bleeding or irregular heavy bleeding. This in turn leads to infertility in later life and recurrent abortions. Obesity. PCOS patients have typically male type of obesity, which is deposition of fat around the abdomen. So we always ask these patients to measure their abdominal girth around the umbilicus. So the abdominal girth should not be more than 30 inches. So obesity causes increased hypercholesterolemia, leads to hypertension and diabetes in later life. It also causes sleep apnea, which is an obstructive disorder of sleep. Because of this, these patients don't have sound sleep, and when they wake up, they don't feel fresh, they don't feel rejuvenated, they feel lazy and lethargic the whole day. About 30 to 35% of patients also complain of acne. Next component is the anxiety disorders. This is the most neglected part of PCOS. PCOS patients have got lot of mood swings, depression and anxiety. They are very sensitive. They overreact to things. Because they don't have a sound sleep, they are irritated the whole day. They tend to cry easily and get into depression very easily. The main pathology in polycystic ovaries is hyperinsulinemia. We will be discussing about insulin resistance and hyperinsulinemia in our next video. Now coming to the diagnosis of PCOS. When a patient comes to us, we first take the family history of the patient. So if there is family history of PCOS in the mothers or the mother sisters, then they are more likely to have polycystic ovaries. If their first cousins and their own siblings have had PCOS, they are more likely to have PCOS. Next comes the physical examination. When we examine these patients, they tend to have central obesity and some characteristics of hirsutism. They have unwanted hair and they may have acne. Third is the laboratory investigation. The ultrasound may show a polycystic pattern of the ovaries, and there might be biochemical indicators of hirsutism as in increased testosterone and increased fasting insulin levels. The important thing that needs to be noted in PCOS is all the patients may not have all the components of PCOS. Some may have only irregular periods, some may have only obesity, some may have only hirsutism, or some may just be having lean PCOS with only hirsutism and depression. So please leave it to your doctor to diagnose PCOS and follow the treatment as advised. Thank you.